Welcome back. It is a Free Stuff Friday. We're looking for you. Got goods to give away here. Dr. Daniel Nickles has shown up. You handle those appointments real well.
Well, thank you
you
very
show
much.
up when you're supposed to.
Absolutely. Even with artists here, and I had to get through a maze to get here.
She parked 3 blocks away to get here.
All of our guests deserve a gold star today for tackling that parking.
Well, you've got a great dental practice going on, and
Well,
we have some new things to talk about.
Sure.
One is dry mouth.
Dry mouth, absolutely. It's something we deal with every day. Going to show this here.
That's going to be hard to find.
About 5 years ago, this list was about 100 medications.
Cause dry mouth?
That cause dry mouth. Now there's over 400 medications on this list right here that cause dry mouth.
So when we see the medications advertised by all of the pharmaceutical giants, and they give that list of will cause, dry mouth is one of them.
Dry mouth is a major part of a lot of things from antihistamines.
But
we all have allergies, antidepressants, anti-anxieties.
Why is it such a bad thing? Because I've heard the list of side effects, and honestly, I think that most of us would go, dry mouth not so bad to deal with compared to
other
thoughts of suicide.
Sure,
I mean, that's one of the ones.
The saliva in your mouth is filled with calcium.
Okay.
And so as you produce saliva, we eat, the acids start eating in our teeth. And then the saliva comes in and it bathes, and it's rebathing those teeth, and it's recalcifying those teeth. And especially when you sleep at night, your teeth are being recalcified every night. It counteracts the foods and the acids we eat all day. So if you take away the saliva, which bathe the teeth in that calcium solution and help the plaque move off the teeth, you have a dry mouth. Everything sticks to the teeth, and it is a major epidemic in the older people and people on antidepressants, anti-anxieties, to where they will get decay and their teeth literally just start decaying all around the gum line.
A lot of very commonly prescribed meds on here, too.
Yes.
If you have dry mouth, would you know it? I mean, is it like you would know?
Most people, you'll see them. They'll come into my practice. I'll see people, they'll come into practice, and they'll have maybe like, a water bottle. And, and that's good, because we start talking about, it starts with a conversation. I see you have a water bottle. Let's talk about these things, because unfortunately, by the time they get to me and we discover it, and if they're going to be on these medications long term, we start talking about maybe having to edentulate them, take all their teeth out, and place implants and dentures. Because it becomes a thing of, having to fight. You can't take them off the medication for, a lot of problems are on. And their teeth literally just, no matter how many times you fix them, they just keep re-decaying.
Because it's not that it's dry. The water in a water bottle is not going to give you the same thing saliva does.
The water does not have, the calcium solution in it. But the bad thing is a lot of people, when they start developing the dry mouth, they start drinking sodas, sweet tea, and it just exacerbates the problem.
Sweets are a whole nother.
Sweets just
Can you take calcium supplements or calcium? Is there water that has calcium?
They're coming out with different things, and there's actually a new product called MI Paste, which is fluoride and calcium.
Okay.
And so we start trying to fight the people who have a good leg up and can fight it. But literally, when these people get on these medications, every time they eat, they literally need to go to the bathroom, brush, and floss, because they got to get the sticky plaque off the tooth.
Okay.
Because if not, it'll sit there and it won't wash off.
All right.
Well, I'm totally depressed. Let's change subjects.
Let's do.
Let's talk about something
You're
good.
doing good things. You're doing good things with Botox.
Absolutely. Oh, that's been a wonderful thing.
I think Jack and I are the last people standing that haven't had this.
I'm going to do myself next week.
And we're on TV.
And we're on TV. Convince me.
Convince you.
Yes.
The great thing about Botox is just as you treat people with it, my dad had these lines, and I thought, man, that's cool. I want those lines. Now I have these lines.
And you don't want
those lines. Because when you go to places and you don't get carded anymore, and people call you sir, we want to be young.
Right.
And it's a good way to just get rid of those lines, to smooth those muscles out, and it restores that youthful appearance. It will take years off your age.
I have literally hugged cashiers for carding me. I'm just saying.
Yeah, it's a good thing. It makes you feel good.
All right. So we want to talk about the fact that sometimes Botox is done incorrectly. You and I were talking about this during the commercial break, and I said, but I don't want to look like Spock.
Right.
And we've all seen that, where people can't make a facial expression. Oh, watch the soap operas this afternoon on our own station.
They all
You'll
got
see
it.
it.
Yeah.
And they're supposed to have expression. There's a way that's done incorrectly.
The most important thing is, it's kind of like people have jumped on the Botox bandwagon going, I'll provide this. It is something to be taken very seriously, because the results do last for 6 months. And it's all about the placement. You have to know the muscles, their movements, and it's easy at that point. And it's just not, you've got to discuss with the patients, you've got to watch the way that their face moves, and then you know where to place it exactly. And so there is a science to it, and when that is ignored, bad things happen, and Mr. Spock comes out. So,
he's watching how my
Why do you
face
say
moves. I can
Mr.
see
Spock?
it.
He had a bad job.
No, but just the way Spock's eyebrows went.
How his eyebrows went up?
I used to have
Jack
to
Nicholson-
say, I haven't run into
The Joker.
Spock
Yeah,
lately.
the Joker. Jack Nicholson has that where the eyebrows,
Yeah.
they injected, they inject across the top.
But
So
now
the
Botox is
I'm
filler.
so sad.
I forget what you said it was.
Botox is actually the botulinum toxin, but it actually paralyzes that muscle, and it smooths that muscle out over time.
There's a correct way. I have some friends who've done it. They've done it correctly. I never knew they did it. I just said,
that's what you want.
And I said, man, you look wonderful. Never did I think, oh, you went and had Botox.
Sure.
So it can be done.
It's like a good toupee. You never say you
don't know.
It's like
that's a good toupee because you don't know it's a toupee.
It's like a good set of veneers. People say nice teeth, not nice veneers.
Yes,
that's what you want. That's
and
right.
I ran into a guy the other day bragging about you.
Well, thank you.
And a beautiful smile. Hey, the national anthem played on a fiddle will knock you out. It's coming up.
An electric one.
Yes.
Amazing. Do not miss it. And don't forget Mother's Day is right around the corner. Your Carolina and Smithworks Fine Jewelers, they've teamed up. We have with them. Beautiful jewelry store, and we are giving away something for Mom. That's right. You can win a Love Bright necklace made by Ashi Diamonds. It's a 9-stone cluster pendant on an 18-inch box chain. It's all in 14-karat white gold. To be eligible to win, you just have to answer the following question. What's the best advice your mom, grandmom, or aunt, or any of the moms in your life have given you?
Clean up your room.
There's no right answer, so make sure you're registered at yourcarolina.tv.